Okay, we will start now. Hello, welcome to this webinar about CARICOM PANCAP CVC Coin Global Funding Multi-Country Regional Grant with the participation of Dr. Shellon Bovell. I am Diego Mora. I am LAC platform consultant, and it is a pleasure to be with you today. On August 16, the board of the Global Fund to Fight AIDS, Tuberculosis, and Malaria approved a $6,500 US multi-country Caribbean grant for PANCAP CVC coin. The CARICOM Secretariat will serve as the principal recipient, while PANCAP, CVC, and coin will serve as sub-recipients. The Caribbean Public Health Agency, the Pan American Health Organization, and the Cuban National Center for Sex Education are sub-recipients. The grant, titled Sustainability of Service for Key Populations in the Caribbean, began on 1st October 2019 and will end on 30 September 2022. Men who have sex with men, sex workers, and transgender people are direct beneficiaries of the grant, which will be spread across 10 countries: Antigua and Barbuda, Bahamas, Barbados, Belize, Cuba, Dominican Republic, Guyana, Haiti, Jamaica, Suriname, and the Republic of Trinidad and Tobago. The goal of the grant is to provide sustainable prevention, treatment, and care service for key populations in the Caribbean region. And to explain ourselves better, we have a great guest today, Dr. Shellon Bovell. Dr. Bovell has worked in HIV for over 50 years. Her career in public health started on the USA-funded Guyana HIV/AIDS Reduction and Prevention Project, where she traveled across Guyana supporting prevention, care, support, and treatment service. Her expertise encompasses both the health and education sector. She has been involved in training of healthcare professionals, including providers of care and program managers in comprehensive health care and management programs. She participated in the development of national level policies and protocols which define the quality assurance, control, and improvement systems for prevention and care service. She has she has leveraged support and developed interventions that enhance health systems for various key population groups across all regions in Guyana. Dr. Bovell managed the CARICOM PANCAP Global Fund project, which ended on 30 September 2019. She now provides oversight to the CARICOM PANCAP CVC Coin Caribbean Regional Multi-Country Global Fund project, for which the CARICOM Secretariat is the principal recipient. Dr. Bovell is a medical doctor with a Master's of Science and Master of Public Health. Welcome, Dr. Bovell. It's a pleasure to have you here with us today.
Good afternoon, Diego. Thank you for having me. The pleasure is mine. Good afternoon, colleagues from Latin America and the Caribbean region. Are you hearing me?
Yes, we can hear you. Dr. Bovell, you have a presentation for today?
Yes, I do.
Perfect. I will finish my... You can share your presentation?
Okay. Yes.
Now.
Oh, I'm now. Okay.
Perfect.
It's up?
Yes.
All right. Thank you so much again, Diego.
Thank you. Thank you for joining us today.
The pleasure is mine. And good afternoon again, colleagues from Latin America and the Caribbean. This afternoon, we'll spend some time discussing the CARICOM PANCAP CVC Coin Multi-Country Caribbean Regional Grant that is funded by the Global Fund. As Diego identified earlier, this project began on the 1st of October 2019. In my presentation this afternoon, I will provide an overview of the project, the background and the rationale, the goal and the objectives, PANCAP's interventions in this particular project. CVC and COIN, they're also our sub-recipients. So we have 3 sub-recipients, PANCAP, CVC, and COIN, their interventions. And then we'll spend a little time just discussing the implementation map before I conclude. So the funding for the grant, as Diego identified, was US 6.5 million. It's a multi-country grant, 10 beneficiary countries. Our title is Sustainability of Services for Key Populations in the Caribbean. We started the 1st of October 2019. The project runs until the 30th of September 2022. The CARICOM Secretariat, or the Caribbean Community, is the principal recipient of the grant. So let's spend some time looking at who our sub-recipients are and who are some of the sub-recipients under each of our sub-recipients. As I identified, our sub-recipients, we have the PANCAP Coordinating Unit, for which we have PAHO, the Pan American Health Organization, and the Caribbean Public Health Agency, CARFA, the sub-recipients. The Caribbean Vulnerable Communities Coalition, CVC. The sub-recipients under CVC are the Caribbean MedLab Foundation, CMLF, and the Caribbean Regional Network of People Living with HIV and AIDS, CRN Plus. COIN, or Centro de Orientación e Investigación Integral, COIN, they have one sole sub-recipient, which is Centro Nacional de Educación Sexual, CENISEX. So altogether, we are having 5 sub-recipients for our 3 sub-recipients. Our 10 beneficiary countries on this particular grant are Antigua and Barbuda, Barbados, Belize, Cuba, Dominican Republic, Guyana, Haiti, Jamaica, Suriname, and the Republic of Trinidad and Tobago. So what were some of the strategic focus as we look at maximizing impact? The project really seeks to address the following challenges that are present in our region. The stagnating new infections with increasing new infections in some countries and among men. So the epidemiology will show some of these results. Inadequate progress in maintaining persons living with HIV on treatment and achieving viral suppression. The declining funding for HIV, and of course, we all know of the donor transition that is occurring, and expanding national programs to implement Treat All. The goal of this particular project is to provide sustainable prevention, treatment, and care services for key populations in the Caribbean region. We have 4 objectives. 1, to increase domestic resources for effective key population programming. 2, to mobilize resources for key population organizations. 3, to reduce structural barriers to key population services, including stigma and discrimination and gender-based violence. And the project that previously ended, which was removing barriers, focused a lot on some of these structural barriers. So we continue to address the barriers in terms of addressing the barriers for key population services. And 4, to improve knowledge generation and the use of strategic information on key populations for decision making and advocacy by communities and our stakeholders. So we hope to enhance and improve our advocacy among stakeholders by our key population leaders. We're looking strategically at two broad activities under the grant: programs to reduce human rights related barriers to HIV, and the focus there is HIV related legal services, and we are looking also at community responses and systems. So the institutional capacity building, planning, leadership, and development of those key skills among our target population. Our target groups are men who have sex with men, sex workers, and transgender people. What were some of the conceptual information or conceptual strategies that went into the formation of our framework? As with the previous grant, the project really addresses the top-down, bottom-up strategies that the previous grant, as I said before, looked at, effectively working towards integrating approaches that strengthen national level programs and really includes the civil society organizations and the community as equal partners in decision making, in planning, in implementation, in oversight with programs on the ground. And this was the platform from which PANCAP really focused their attention on high level regional advocacy and convening actions. CVC and COIN, on the other hand, worked with key population networks to ensure that the voices, the needs, the strengths, the capacities, and capabilities of our regional leaders among civil society is integrated into our regional HIV response. So together, PANCAP, CVC, and COIN, we hope that the regional reach really strengthens our national implementation of partnership approaches to capacity building and, of course, really looking at the delivery of services to our key population organizations and members. So the coherent approach to achieving this, our regional goal, is the top-down change agenda with high-level regional advocacy stakeholders, as well as the bottom-up, which CVC and COIN collaboratively provides in terms of really ensuring that our key population voices are integrated, are heard, and are effective in terms of leadership in the region. What are the complementary strategies as we commence our implementation? Capacity of our national programs to provide high quality and appropriate services to reach key population. We also want to ensure capacity of our civil society organization to implement not only programs, but ensure that these programs are sustainable. We want to ensure that we facilitate joint implementation so that government as well as civil society work in partnership with each other to bring about innovative approaches to prevention and treatment services. We have high level advocacy for enabling environment. So we want to promote human rights and the domestic resources for HIV programs. And a lot of our efforts in this grant will be facilitating that process. Uh, Civil society organizations and community leadership and national level advocacy. We want to ensure that quality services are provided. So we definitely would want to build the capacity of our civil society organization and community leaders so that they can advocate not only at the level of the constituency, but also at the national level. What are some of the interventions under PANCAP's mandate? PANCAP will, under this grant, leverage existing networks, PANCAP networks, including champions. And we have a number of champions for change that have been identified, and the National AIDS Program managers to sensitize government officials and other stakeholders on the economic benefits of increasing funding for HIV programming for a key population. PANCAP will also facilitate knowledge sharing and learning of successful civil society organization experiences and models of resource mobilization to ensure we have the partnership development through online learning, etc. And we have our K for Health program, which has moved the leaps and bounds in terms of knowledge management, knowledge sharing, learning journeys, etc. So we hope to really maximize our interventions as it relates to knowledge management. Leverage private sector support for sustaining HIV response, support domestic public financing for civil society role in the HIV response. Additionally, PANCAP will conduct high-level advocacy to increase awareness of gender-based violence and link that to vulnerabilities. And they will continue because we started supporting our national AIDS program managers and key population partners in a annual forum. So this forum will continue where strategic information will be developed, expanded, differentiated models of care will also be disseminated. Interventions and on treatment and care services for key population will also be discussed. And this is a forum for which our national AIDS program managers come together to really look at what are the challenges, how can we work together as a region to address the challenges, how can we work together to share our expertise, to share our resources, to ensure that everyone is taken into consideration as we move forward as a region. PAHO, which is a sub-recipient on the PANCAP, will continue to enhance innovative, comprehensive HIV and STI services for adults, adolescents from the key populations. They'll also continue to expand on access to comprehensive HIV STI services through the differentiated service delivery models. CARFA, CARFA has worked with us on the previous grant. They will continue to conduct data analysis, capacity strengthening with the decision makers, national AIDS program managers, key population networks for evidence-informed decision making. They will continue using our data repository, which was expanded under the previous Global Fund grant, to improve generation availability, the use of strategic information on key populations to support evidence-informed decisions. CVC COIN and their SSRs will be involved in activities to address stigma and discrimination, strengthening of the national strategic plans to ensure inclusion of key population issues in selected countries. So to that end, CVC did significant work on their shared incident database, and that will continue as a medium for which we can share information. They'll continue to strengthen key population participation in the national strategic plan and the dialogues that go on at the table. They continue to train in terms of community-based monitoring and community scorecards for healthcare facilities. And of course, they will facilitate small grants to support national and regional anti-stigma and discrimination campaigns. They will also be involved in programs to reduce discrimination against women and girls in the context of HIV. So training for women and girls at risk to reduce gender-based violence and transactional sex. They will also be involved in the development of referral tools to support gender-based violence affected individuals. Additionally, CVC and COIN and their sub-recipients will be involved in community-based monitoring and advocacy for policy and law reform. And this is something that has started. So we have the capacity and the capabilities to continue to work with our national and regional level stakeholders, with our small grant recipients, and also to provide that forum for advocacy for civil society organizations and key populations. Programs to provide HIV-related legal services. So how do we support the establishment of redress system in selected countries? Support for pro bono lawyers, providing services to key population, and really looking at our public defenders and pro bono lawyers in human rights and key population needs, including some internships and opportunities through our civil society organizations for persons to really gain expanded experience and expertise in this field. They will continue to conduct in-service training for healthcare workers on human rights and medical ethics, the development of IEC materials as a main tool in terms of these trainings, adaptation of the toolkit for healthcare workers and law enforcement officers. Additionally, training with law enforcement officers and agencies where the institutionalization of human rights and key population sensitization for our officers will be done. They'll continue, they know your rights and legal literacy for communities, where the general human rights issues will be a part or will be disseminated to participants. And they'll support community paralegal programs and interventions to support key population redress. So that is a mouthful in terms of all of our implementation targets. I would just want to go through now what are some of the key things, just it's a synopsis of the key things, highlighting also who are our target populations as we move forward in the implementation of this project. So the PR, principal recipient, we will be quite involved in terms of our project, reporting on the project, ensuring that we monitor the funds of the project. So both the programmatic and the financial project audits will be conducted as usual. We will have our governance bodies available. We are working now with our TAG, our technical advisory group, as well as the priorities area coordinating committee and the executive board for PANCAP. And we also will be involved in the end of project evaluation as a main output of this particular grant. As we said before, PCU, or the PANCAP coordinating unit, will be involved in high-level policy dialogue. They'll be involved in regional policy and agreements, and they will be involved in strategic information systems and facilitating improved services for key population. With whom, you might ask? With our policymakers, our heads of government, our faith leaders, persons living with HIV, persons belonging to the key population group, men who have sex with men, transgender group, our sex workers, our migrants, youths from these groups. And PANCAP, to note, is strategically placed within the CARICOM Secretariat, so they have access to our organs and bodies where advocacy and policies and governments in terms of sustainability will drive their intervention. Yes, CARFA will work with our monitoring and evaluation officers and our NAP managers to ensure that strategic information, reporting, data analysis, and information is streamlined as we continue to support and ensure best practices and lessons learned are disseminated. PAHO, as we said before, will continue to support our civil society organization and key populations in terms of care treatment, our providers of care, our managers, and our focal point. The focus of their intervention is, as noted, is our differentiated delivery models, our comprehensive care and treatment services. CVC, key populations, the target groups, civil society, our transgender population, our sex workers, our youths, our drug users, our persons living with HIV, supporting activities geared towards increasing domestic funding for key population, building capacity of our key population to support sustainable resource mobilization, interventions to support the reduction of human rights barriers, and generating research to improve knowledge and the use of strategic data. This is quite similar to COIN's approach in terms of their implementation of the project. What is unique, CMLF, the Caribbean MedLab Foundation, will be involved in best practices and lessons learned from service delivery models that address HIV testing and lab needs of key population. As you know, we do a lot of HIV testing, but really strengthening of our labs, strengthening of our lab facilities, etc., as we document our best practices, as we document and share and promote effective testing and lab services. And we talked about CRN Plus and their differentiated models of care support. They focus on advocacy and capacity building among people living with HIV and their regional networks and communities. COIN is quite similar to, their support will be quite similar to CVC in terms of the target groups, Ministry of Health managers, pro bono lawyers, law enforcement officers, support activities geared to increasing domestic funding, building capacity and sustaining resource mobilization, reduction in human rights barriers, and of course, structural barriers for access by key population services, really addressing stigma and discrimination and gender-based violence. And CENISEX, no different. CENISEX sub recipients on their coin hopes to increase some of the awareness as coin support for our communities, our key population programming in Cuba. So in a nutshell, those are some of the key interventions that our sub-recipients and our sub-recipients will be involved in over the course of the 3 years of funding. We hope that periodically we'll be able to provide a progress update to our LAC constituency in terms of where we are with the grant. But we go up until September 2022, and we hope that we are geared. We know and we hope that we are geared to implement this grant to the best of our abilities as we move forward. I'm not sure if there are questions at this time, but we can definitely address those as we move forward in this presentation.
Thank you very much for this great presentation, Dr. Bovell. Now, does anyone have questions? Please make sure that you have the microphone open to ask the question. No one? Dr. Bovell is here to answer all your questions. It is the time.
Actually, Diego, just to say, we hosted our the Grand Inception meeting about 2 weeks ago, the 22nd of October, where we had an opportunity for our implementing agencies, our sub-recipients, as well as sub-recipients, come together to really address all the issues and as we start implementation, discuss our roles and responsibilities, both from a programmatic standpoint as well as a financial standpoint. And of course, M&E monitoring evaluation plays a major role in our implementation. So we are definitely going to be developing and streamlining our monitoring and evaluation plan and framework as we move forward.
Hello, I have one quick question though. Can you hear me?
Yes.
Right, so I was curious about us having a discussion around the very antiquated language that we continue to use, even though a lot of times we have had conversations in spaces and persons have discussed how particular terms have added to stigma and discrimination are very problematic, but yet still our data or research continues to use these terms as pretty much an okay term when persons have discussed already. And I'm drawing attention to this because I've seen a section of your presentation where you mention how important it is to recognize the value of everyone's voices. And I've been in a lot of spaces where persons have told you guys that words like key population is very problematic and adds to stigma and discrimination, but yet still we continue to use these words and continue to see these words perforate like research and documents and presentations, and there's no discussion around moving away from these terms. And that's just one of many problematic terms that you guys continue to use. Not clear?
Hello? Yes, thank you so much for your feedback. Definitely, I think this is something we will need to address with even our donors, even as we conceptualize our projects moving forward, and really look at what are the appropriate and acceptable terminology as we address these matters from the platform, from a regional platform, and even from a global platform. I appreciate your feedback. Thanks so very much.
Oh, yes, one other question. As it relates to, well, you guys have secured grant money already. And what I've recognized is that we have been funding the same kinds of projects over and over and over again. And there's no like clear intention to put funding in programs that are led by persons who are most affected. A lot of the program requires us to navigate spaces that have other stakeholders like government and faith-based leaders, and I understand that and I respect that, but I think there is real value to be had from conversations where persons who are most affected can lead discussions in terms of if there was an opportunity for us to fund a project where those most affected could reflect on the kinds of research that they would want to see. So we could have like a training program where, or opportunity for growth rather, because training sounds very colonialistic. So an opportunity for growth, and persons could like explore research methodology, and then afterwards they could do their own research on the kinds of things that are affecting their community. And I say this because I've seen where a lot of times the discussions that we are having are very antiquated. So for example, I remember there being a discussion about how young people are not using condoms because it's difficult for them to negotiate condom use. And if you have a conversation with a lot of youth, then you'd recognize that what's really happening is not them having like this major difficulty to negotiate condom use, but a lot of them aren't using condoms because it's a lot more pleasurable to them. So when we have programs that focus on empowering, inverted comma, young people with the know how to discuss, negotiate, how to negotiate condom use, and then these persons don't believe they are not empowered enough to negotiate condom use, then what we have is a discussion that does not appeal to persons because it's not something that's affecting them. So if we could secure some grant money to have persons discuss their own realities and provide research to research and provide data on the things that truly affect them and not depend on academia to tell us what's really happening to people. But yes, it would be framed through an academic lens, since persons who will be leading the research methodology training would be persons from academia. So I don't know if there's an opportunity for us to maybe investigate that.
All right, thank you for those very valuable points. And just to note, CVC and COIN, as well as their sub-recipients, are involved, and their grantees, because they have mini grantees, are involved in similar projects as identified, where you know, a small pot of money might be available to do some research, to do an intervention in communities in the beneficiary countries as listed. So we do have those interventions slated within our implementation and our work plan for CVC and COIN as they work with, you know, in the grass, in the fields with their grantees and with their sub-recipients. But we take note of your recommendation.
Dr. Bovell, Kennedy here from Belize. I'm very much interested in what lessons have been learned. We know that there are many challenges in terms of coordination among sub-recipients at the national level, and I always think about how it is challenging at the regional level. Can you share with us at least some of the lessons learned in terms of coordinating these three entities, PANCAP, CVC, COIN, to ensure harmonization and effective implementation of the grant? Thanks.
All right, thank you for that question, Kennedy. I think what is key as we look at coordination for effective implementation, communication as well as information sharing becomes essential when dealing with multi-country grants and multi-country implementation. And I think clear communication, documentation, as well as really knowing where the responsibility lies has been quite beneficial as a tool or as a framework for moving forward, because of course we are a diverse region. I know we have and we hold very closely to our hearts the Caribbean Regional Strategic Framework, and we just actually developed the 2019 to 2025 strategy, which comes with an operational plan as well as a communication plan. I think that too lends some support to working in the region and really seeing and identifying among ourselves what are our priorities. And we were all involved in this process. So even as we communicate, even as we develop our priorities, etc., definitely working towards our common good through an action plan will yield and has yield some success. So we see that also as a great stream of collection of ideas, as inclusivity or inclusion of key players and stakeholders in the process, and as a tool for moving our response forward. In addition to that, I believe the need or the mere desire and the passion to support our region aids that process. We are now at a platform whereby under the previous grant we had complementary strategies, actions, implementation goals, and I think we worked quite well with CVC, COIN, and PANCAP throughout the previous grant. And now that we are embarking in this multi-country grant, I think we're poised to succeed.
Thank you so much, Dr. Bovell. Someone else? Another question for our guest today? Okay. Dr. Bovell, thank you so much. Where we can find more information about that?
So in terms of the project, we will make information available on the PANCAP website as well as CVC and COIN's website and social media pages in terms of where we are. We also are quite well, we feel quite at home in terms of the LAC platform, and we can be available periodically, possibly at the end of our program year, to provide an update on where we are with our grant in terms of our progress to via webinars to the LAC constituency. I'm quite open to that as we move forward.
Perfect. Do you want to add something else?
And we can talk about that, Diego, as in terms of what other opportunities exist for sharing information on the grant.
Yes, please.
Thank you. What I also want to note is, as I mentioned before, the Caribbean Regional Strategic Framework is definitely the driver of our implementation as a Caribbean region. And we can also share this document with you for widespread circulation. It was recently developed following an evaluation of the previous CRSF, 2014 to 2018, and stands as the vehicle of support for our interventions and our response regionally.
Thank you so much, Dr. Bovell, for joining us today. You are a very special guest for us in this webinar.
Thank you for having me, and please feel free, if you have any further questions, you can channel them to me. I am on the LAC platform, and I stand ready and available to answer your questions. I also want to acknowledge our PANCAP, our CVC and COIN colleagues who are on the webinar today. Thank you for your participation. And thank you, our LAC colleagues, for your questions and participation this afternoon.
Thank you so much. For everyone, don't forget to visit our website. Plataforma LAC is in Spanish, but you can add .org/en, and our social media in Twitter, Plataforma LAC, and you can find us in Facebook too. And don't forget, you can join the community. In LAC Stanford webpage, you can find more information about that. Thank you for joining us today, and see you in the next opportunity. Bye-bye. Thank you, everyone.
Thank you, Diego. Bye-bye.